All right, welcome back, everybody. Today we are going to be kind of cracking the code on a pretty fascinating trend
Oh, yeah.
in healthcare training. Escape rooms.
Escape rooms.
Yeah.
Wow.
We're talking about how these puzzle-filled adventures, right? They're being used to boost teamwork
Yeah.
in those high-pressure medical settings.
It's pretty intriguing how something seemingly designed for entertainment can be adapted
Right.
with such serious purpose, you know?
Yeah, exactly.
It's pretty amazing.
Yeah, and to kind of guide us through this whole deep dive,
Right.
we have a research study that looked at how escape rooms are being used to teach crew resource management, or CRM,
Yeah.
which is all about optimizing teamwork and communication,
Yeah.
especially in acute care.
Think about those intense situations in the ER or the ICU or even the operating room where split-second decisions and seamless coordination can literally mean the difference between
Oh, I know.
life and death.
Yeah.
It's pretty serious.
Oh, yeah, absolutely.
Yeah.
I remember shadowing an ER doctor during my residency.
Oh, wow.
And the way the entire team worked together during a trauma case, it was incredible.
Yeah.
Everyone had like a specific role. Communication was so crystal clear, and they just moved with this synchronized precision. It was honestly a bit awe-inspiring.
That's the essence of CRM in action.
Yeah.
And the beauty of escape rooms is that they can replicate that kind of high pressure,
Right.
time-sensitive environment in a way
Right.
that traditional training just can't.
Totally.
Yeah.
So let's get into the details.
Yeah.
This research we have is a scoping review, meaning it analyzed data from multiple studies on the topic.
Okay.
So what's the big takeaway here? I mean, are escape rooms actually effective for teaching these critical teamwork skills?
Well, the findings are quite promising, actually.
Okay.
The review looked at 14 studies, all focusing on escape rooms, designed for healthcare professionals in acute care settings.
Okay.
And what's fascinating is that they found some common threads in how these escape rooms were designed.
Okay, I'm all ears. So give me those design trends. Yeah.
Well, most of the escape rooms involve teams of 4 to 6 people,
Okay.
which makes sense considering that's a typical team size in many
Right.
clinical settings, and they usually had a time limit of around 40 minutes.
Okay, so 40 minutes
Yeah.
to solve a series of puzzles with your colleagues.
Yeah.
I mean,
Yeah.
that definitely adds a layer of pressure.
For sure.
But wouldn't a time crunch kind of make people less likely to communicate effectively?
Right.
Like if I'm racing against the clock, I might be tempted to just focus on my own task
Sure.
and forget to share information with the team.
That's a great point, actually, and it
Yeah.
really highlights the importance of careful design.
Oh,
The structure of the puzzles themselves can play a huge role in encouraging or discouraging teamwork.
Okay. So there's more to it than just throwing a bunch of puzzles together and yelling, "Go team."
Exactly. The most common puzzle structure they found was linear,
Go.
where solving one puzzle unlocks the next, kind of like following a step-by-step recipe.
Yeah. Okay. I get that.
Yeah.
But wouldn't a linear structure, I mean, wouldn't that make things too easy in terms of teamwork?
Uh-huh.
I mean, wouldn't it be more effective to have like a structure that really forces people to communicate and collaborate more actively?
You're absolutely right.
Okay.
And the review actually hints at that,
Okay.
suggesting that more complex structures where multiple puzzles need to be solved simultaneously
Oh, okay.
may be even more effective for teamwork training.
Okay.
So imagine a scenario where different team members need to gather clues from different parts of the room
All right.
and then come together to synthesize that information and solve a final overarching puzzle.
That's a brilliant example. I like that.
Yeah.
It really forces people to share information, delegate tasks,
Okay.
practice like those leadership and coordination skills that are so essential
Right.
in a real medical setting.
Precisely.
Okay. So this is where the research gets even more interesting.
Yeah.
It highlights a major gap in many of the studies,
Okay.
a lack of clarity in how those escape rooms were specifically designed to target and measure
Right.
teamwork skills.
Yeah.
So just saying, like, it's collaborative by nature
Right.
isn't enough.
Unfortunately not.
Okay.
Many studies didn't adequately explain how the puzzles and challenges
Right.
were directly linked to specific CRM principles like
Yeah.
communication, leadership, and situational awareness.
So it's kind of like saying, like, exercise is good for you
Right.
without specifying what kind of exercise is best for building muscle or improving cardiovascular health.
It's too vague.
It's too vague. Thing there. All right, I'm officially hooked.
Right.
We talked about the basic setup and the importance of puzzle structure.
Yeah.
But did the studies actually show that these escape rooms made a difference
Yeah.
in how healthcare teams actually function?
Right.
Like did it actually translate?
Well, the majority of the studies focused on
Okay.
participant reactions and feedback after the escape room experience.
So did the doctors and nurses actually enjoy these escape rooms?
Right.
Were they running for the exit, or were they actually engaged?
They loved them.
Really?
Almost universally, the feedback was overwhelmingly positive.
Wow, that's pretty amazing.
Yeah.
So they actually felt like they were learning something.
People generally felt
Yep.
that participating in the escape room improved their teamwork skills.
Okay.
Some studies even dug a little deeper using like focus groups
Oh wow.
and even video analysis
Oh wow, really?
to understand how the experience impacted teamwork attitudes
Okay.
and how participants applied what they learned.
So it's encouraging to hear, but it sounds like more research is needed to really know how these benefits translate into real world clinical settings
Right.
and ultimately impact patient care.
Yeah.
It's one thing to like ace an escape room,
Yeah.
but can those skills truly help a team navigate like a chaotic ER
Right.
or a complex surgical procedure?
You're spot on.
Yeah.
We need more research to measure the long-term impact on teamwork behaviors
Okay.
in real clinical settings and ultimately on patient care.
Yeah.
That's a crucial next step for this field of study. But
Okay.
but here's where things get even more exciting,
Right.
where we can really start to brainstorm some innovative ideas. Remember that gap in the research we talked about? The lack of detailed descriptions of how these escape rooms were designed.
Right. Yeah.
Well, that opens up a whole world of possibilities for us to explore.
Okay, I'm ready to dive into that rabbit hole.
Right.
What specific design elements do you think could make these healthcare escape rooms even more effective, especially in terms of bridging that gap between the game and real world clinical skills?
Well, the first thing we need to do is move beyond simply saying
Okay.
an escape room is good for teamwork,
Okay.
because it's collaborative by nature.
Okay.
We need to be much more intentional
Yeah.
about designing every aspect of the experience to target specific CRM principles.
I like that. It's all about being deliberate
Yeah.
and purposeful, not just
Yeah.
like throwing a bunch of puzzles in
Yeah.
a room and hoping for the best.
Exactly. For instance, think back to
Yeah.
how we talked about those complex puzzle structures
Yeah.
where multiple puzzles need to be solved simultaneously. Imagine a scenario where the escape room is set up like a simulated hospital ward,
Okay.
and the team has to manage a simulated patient emergency.
Okay. I like this.
Maybe one team member needs to gather information from the patient's electronic medical record,
Okay.
while another analyzes lab results
Right.
and another prepares medications.
Okay.
They'd all have to communicate effectively,
Right.
share information,
Right.
and coordinate their actions to stabilize the patient.
Right. So you're essentially
Yeah.
recreating the dynamics of a real medical team,
Exactly.
complete with the pressures of
Right.
time constraints and limited resources.
Precisely, and that's where we can get even more creative.
Okay, let's get creative. I'm ready.
We could incorporate technology
Oh,
to make those simulations even more immersive.
all right. Tech in the escape room.
Yeah.
I'm intrigued. What kind of technology are we talking about?
Well, for starters, we could use augmented reality or AR,
Okay.
which allows participants to overlay digital information onto the physical environment.
Oh, yeah.
using tablets or smartphones.
Okay.
Imagine a team member examining a simulated patient in the escape room
Okay.
and then using AR to pull up their vital signs, lab results, or even medical imaging,
Okay.
just like they would in a real hospital setting.
Wow, that's incredible.
Yeah,
It adds another layer of realism and complexity to the experience.
right.
But what about, what about virtual reality?
Yeah.
Could VR play a role in these healthcare escape rooms?
Absolutely. We could create entirely virtual escape rooms
Oh, wow.
that simulate incredibly high-pressure medical scenarios,
Look.
allowing teams to practice their CRM skills
Okay.
in a completely immersive digital world.
Okay, now we're talking. VR could really take these escape rooms to a whole new level. I can already picture like teams working together to perform like a virtual surgery,
Right.
or manage a simulated mass casualty incident.
Yeah, yeah.
That's amazing.
It's pretty cool.
But I do have to wonder about like the practical side of things.
Yeah.
Designing and implementing these high-tech escape rooms sounds,
Right.
pretty expensive
Sure.
and complex.
That's a valid concern.
Yeah.
These technologies do require an investment, but the potential benefits for teamwork training and ultimately patient safety
right.
could outweigh those costs.
Okay.
And remember, you don't need to go full-on Hollywood production right away.
Right.
You can start small, incorporating simple tech integrations,
Right.
and then gradually scale up.
Yeah, that makes sense.
Yeah.
It's all about finding that sweet spot
Right.
between innovation
Yeah.
and practicality.
Yeah.
Now I want to go back to something you mentioned earlier about specific challenges
Okay.
to
Mhm.
really
Yeah.
test CRM skills.
Right.
If you were designing an escape room,
Yeah.
what kind of scenarios would you throw at those healthcare teams
Yeah.
to make them sweat a little?
Let's get creative.
Okay, all right, I like this.
Picture a scenario where the escape room simulates a patient who's rapidly deteriorating.
Okay.
The team has to quickly assess the situation,
Okay.
figure out what's going on, effectively delegate tasks, and communicate clearly under pressure
Right.
to stabilize the patient.
Okay.
But here's the twist.
Okay.
They only have limited supplies
Okay.
of critical medications and equipment.
Ooh, that sounds
Yeah.
intense. It's like a real life
Right.
medical emergency
Exactly.
where you don't always have every resource at your fingertips.
Exactly. And that kind of pressure cooker environment
Right.
forces them to prioritize,
Okay.
think critically,
Right.
and put those CRM principles into practice.
Okay.
Resource management, situational awareness, clear communication.
Right.
They have to work together
Yeah.
to figure out how to solve the puzzle and save the patient with the limited resources they have available.
Okay, that's one challenge, Dan. I'm already feeling the adrenaline rush.
All right.
What else do you have up your sleeve?
How about a communication breakdown challenge?
Okay.
Imagine a scenario where different team members receive conflicting or incomplete information about a patient's medical history or their current condition.
Oh, okay.
This is a great way to simulate those real life situations in healthcare where miscommunication can lead to serious errors.
Oh, I can see how that would create some tension and really test those communication skills.
Sure.
Even in a casual conversation, misunderstanding can happen. But in a high stakes medical setting, a communication breakdown could have serious consequences.
Exactly. It forces them to practice those essential closed loop communication techniques where you repeat back information to confirm understanding, clarify ambiguities, ensure everyone's on the same page.
Right.
It also encourages team members to feel comfortable speaking up if they have concerns or questions.
Okay.
Which is absolutely crucial for patient safety.
So it's not just about like passively receiving information.
Right.
But actively engaging in a two-way dialogue
Exactly.
to ensure everyone is on the same page.
Yeah.
That's a great lesson to learn, both in the escape room and in the real world.
Absolutely.
Okay.
And it's important to remember that it's not just about throwing difficult challenges at people. It's also about observing the team's dynamics, their strengths, their weaknesses, and then using those observations to guide a structured debriefing session afterward.
Debriefing, okay, that's a key element.
Yeah.
we haven't talked about yet. It's like the post-game analysis.
Yeah.
Where you break down what worked, what didn't, and how to improve for next time.
You got it. And in this context,
yeah,
the debriefing session is facilitated by someone trained to observe the team's interactions, identify areas where CRM principles were applied effectively or not so effectively, and guide a discussion to help participants reflect on their performance.
So it's not just about like having fun and solving puzzles.
Yeah.
There's a deeper layer of analysis and reflection that turns the escape room into a truly valuable learning experience.
Exactly.
I like that.
The facilitator can ask like thought-provoking questions like how did you decide who would take on which roles and responsibilities? Or how did you manage the stress of limited resources? Or what could you have done differently to avoid that communication breakdown?
I love that. It's like holding up a mirror to the teens' dynamics and helping them see their blind spots.
Yeah.
I can only imagine the aha moments people would have during these debriefing sessions.
Those aha moments are golden.
Yeah.
And here's something else to consider. Those debriefing sessions aren't just valuable for the participants. They can also provide a wealth of data on the effectiveness of the escape room itself.
Wait, so you're not only evaluating the team's performance, but also using that data to continuously refine and improve the escape room design.
Precisely. By gathering feedback from participants and analyzing those observations from the debriefings, you can figure out which challenges are most effective, which puzzle structures work best, and how to optimize the overall experience to truly maximize learning.
It's like a continuous feedback loop.
Exactly.
Just constantly iterating and improving those escape rooms to make them even more powerful tools for teamwork training.
Exactly.
I'm really starting to see the potential here.
And that's where I think the field needs to go. More research is needed, definitely, but also more intentionality in design and a greater emphasis on data-driven debriefing. That's how we can really unlock the true potential of escape rooms for healthcare teamwork.
Couldn't agree more. Now I want to touch on something you said earlier about integrating escape rooms into a broader training program. What other methods would you pair with escape rooms to create a comprehensive and multifaceted approach to teamwork training?
Well, simulation training, which is already widely used in healthcare, is an excellent complement to escape rooms. Healthcare simulation centers offer immersive environments for teams to practice, handling a variety of clinical scenarios, from routine procedures to complex emergencies.
I can see how escape rooms and simulations would work beautifully together, each offering a unique learning opportunity.
Exactly. Escape rooms could provide a foundation in those essential CRM principles, and then those principles could be applied and further refined during more complex and higher stakes simulation exercises.
So it's all about creating a layered learning experience, starting with the foundational principles and then building on that with more realistic and challenging scenarios. But we can't forget about the importance of traditional teaching methods like lectures, workshops,
Absolutely not.
I mean, lectures are still crucial for providing the theoretical knowledge and framework for understanding teamwork and CRM.
For sure.
And then escape rooms and simulations offer a safe and engaging way to put that knowledge into practice. So it's all about finding the right balance between theory and practice, between classroom learning and hands-on experience.
For sure.
And of course, ensuring that those experiences are fun and engaging. Because let's be honest. No one wants to sit through a boring training session.
Well said. But even with the most dynamic training program, we have to remember that teamwork isn't something you learn once and then check off your to-do list.
Right.
It has to be an ongoing process woven into the fabric of the healthcare culture itself.
That's such a critical point. It's about fostering a mindset of continuous learning and improvement, where teams are constantly striving to refine their communication, their collaboration, and ultimately their ability to provide the best possible care to their patients.
Well said. This is an incredibly exciting time to be exploring the potential of escape rooms and other innovative approaches to healthcare teamwork training.
Yeah.
I'm truly optimistic about the future.
Yeah, I'm feeling inspired.
Right.
But before we get carried away with all these exciting ideas, let's bring it back to our listeners and distill some key takeaways for them.
Right.
What are the most important points you want them to remember from this deep dive into escape rooms and healthcare teamwork?
Well, I think the key takeaway here is that effective teamwork isn't something that just happens magically.
Right.
It's a skill just like any other.
Okay.
And it can be learned, practiced, and refined over time.
Okay.
And what's so exciting about these escape rooms is that they offer a unique and engaging way to develop those skills.
Well, it's like that saying, practice makes perfect.
Right.
But in this case, it's practice makes for a more cohesive and effective healthcare team.
Exactly. And just like with any skill, having the right tools and training methods can make a huge difference in how quickly and effectively you learn. Right. Escape rooms provide that safe and controlled environment where healthcare professionals can experiment, make mistakes, and learn from those mistakes. Without any real-world consequences.
That psychological safety is so important.
Yeah.
It's like giving people permission to step outside their comfort zone.
Right.
Try new things. And not be afraid to fail. Yeah. Because in a real medical setting, the stakes are just too high. To allow for that kind of experimentation.
Right. And when people feel safe to take risks, voice their opinions, and learn from their errors, they're more likely to fully embrace the learning process and truly grow as individuals and as a team. And who knows, maybe some of those positive experiences and lessons learned in the escape room can even spill over into their daily interactions at the hospital, fostering a more collaborative and supportive work environment.
I love that idea. It's like building those teamwork muscles in the escape room. So you're better equipped to handle the real life challenges of working in a fast-paced, high-pressure healthcare setting.
It's also worth noting that successfully navigating a challenging escape room together can create a real sense of camaraderie among team members. It can boost morale, strengthen those interpersonal bonds, and foster a shared sense of accomplishment that can definitely carry over into the workplace.
Yeah, it reminds me of that, like that feeling you get after conquering like a tough hike with friends, or collaborating on a challenging project. There's this like sense of unity and shared purpose and mutual respect that emerges from those experiences.
And in a high stress environment like healthcare, that kind of positive team dynamic can be incredibly valuable. It can make all the difference. In those critical moments when clear communication, coordinated action, and unwavering trust are essential for optimal patient care.
So to bring it all home for our listeners today, escape rooms offer a fun and engaging way to train those crucial teamwork skills. But it's important to remember that they're just one piece of the puzzle. We need to think about intentional design, data-driven debriefing, and integration with other training methods to really maximize their potential.
Absolutely. And at the end of the day, it's all about cultivating a culture of continuous learning and improvement within healthcare teams. It's about creating an environment where everyone feels empowered to contribute their unique skills and perspectives to ensure the best possible outcomes for their patients.
Beautifully said.
Yeah.
Now before we unlock the door and escape from this episode, I want to leave our listeners with a little challenge.
Right.
Something to ponder as they go about their day.
Okay.
Imagine that you are tasked with designing a healthcare escape room.
Right.
What innovative features would you include beyond the ones we've discussed to really push the boundaries of teamwork training and create a truly unforgettable learning experience?
We'd love to hear your creative ideas. Share them with us on social media or on our website.
Until next time, deep divers.
Yes.
Keep those minds sharp.
Become sharp.
And those teamwork skills strong.
Coordinated action and unwavering trust are essential for optimal patient care.
So to bring it all home for our listeners today, escape rooms offer a fun and engaging way to train those crucial teamwork skills. But it's important to remember that they're just one piece of the puzzle.
Yes.
We need to think about intentional design, data-driven debriefing, and integration with other training methods to really maximize their potential.
Absolutely. And at the end of the day, it's all about cultivating a culture of continuous learning and improvement within healthcare teams. It's about creating an environment where everyone feels empowered to contribute their unique skills and perspectives to ensure the best possible outcomes for their patients.
Beautifully said. Now before we unlock the door and escape from this episode, I want to leave our listeners with a little challenge.
All right.
Something to ponder as they go about their day.
Okay.
Imagine that you are tasked with designing a healthcare escape room.
Right.
What innovative features would you include beyond the ones we've discussed? To really push the boundaries of teamwork training and create a truly unforgettable learning experience.
We'd love to hear your creative ideas. Share them with us on social media or on our website.
Until next time, deep divers.
Yes.
Keep those minds sharp.
Keep them sharp.
And those teamwork skills strong.